Hello, I'm Alexander Purser. I'm really excited to apply to your program and share why I believe nursing is the right path for me. Answering the question about a time when I experienced a situation where a classmate or peer was engaging in unethical behavior, and how I handled the situation is when I was in my anatomy lab. We had a practical exam where we had to identify muscles on cadavers. Toward the end of the test, I noticed a few classmates quietly sharing answers by showing their papers to each other. I was having trouble on a few of the questions myself, and honestly, it was tempting to look because I knew those answers could really help my score. But I also knew it wasn't right, and I wanted to have a score that was my own, no matter how good or bad I did. After I was done taking the test, I went over to the students and quietly told them that people worked hard to study and that there were going to be more opportunities to get better grades. And by showing each other the answers, it was not going to help them know the material. They said they were sorry. I didn't see them do it again after that. Uh, the next class period, I left an anonymous note on the professor's desk saying, I saw some students sharing answers with each other during the test, and I thought I had the right to bring it to his attention. That was one of the hardest things I've ever done in school. It took a lot of courage to tell my classmates that what they were doing was wrong. I was afraid of looking like a snitch, but remind myself the reasons why and the reasons why I was becoming a nurse. To build trust, to develop a kind of honesty that your patients and colleagues can depend on. I made the decision not to participate or look at anyone else's work. Instead, I did the best I could do with my own knowledge. In the end, I didn't get a perfect grade, but I earned it honestly and felt proud. More importantly, the experience showed how important integrity is, not just in academics, but in nursing practice as well. For the second question, and how do I work in a team environment and a specific time when I collaborate successfully with others? Um, that was at my previous job with Condor Turf. Our team was given a large project of completing a high school football field within a shorter than usual timeline, but we had just hired 4 new employees who needed to be trained quickly. It was clear that if we didn't work as a team, we would risk falling behind on our schedule. As one of the managers on our crew, I led the training process. I showed the new employees how to perform their tasks safely and effectively, and I made sure to explain not just the how, but also the why behind each step. I wanted the new employees to feel supported because, I've been in their shoes and I know how overwhelming it could be. So I worked alongside them, showing each step until they felt confident, answered their questions, and even tried to anticipate the future by demonstrating things like ahead of time. I also communicated with my supervisor to keep everything organized. Watching them grow more confident each day was really rewarding and reminded me how much I enjoyed helping others learn and succeed. We finished the field on time and received, good positive feedback from my boss for how smoothly the job went. Training those new employees taught me that the best outcomes come from open communication, trust, and humility to ask for know the lessons for nursing. For the question of telling an experience where I received unexpected feedback from a supervisor or a coach, and what was my reaction to that feedback was during my time in the Philippines, I was teaching a business education class as part of my internship. When I was teaching a class of 40 plus people in a new area that hadn't been taught in before, one of the leaders that was supervising our class gave me unexpected feedback by saying that parts of what I was teaching didn't fully apply to their situation. At first, I was surprised and honestly a little embarrassed because I was teaching proven business strategies that work well in the U.S., but I quickly realized that business laws, resources, and daily challenges they're very different in that area of the Philippines. Instead of getting defensive, I decided to really listen and understand their perspective conveyed by the students to the supervisor. I asked a follow-up question to learn more about their troubles in that area, things like costs, the access to materials, how business was typically done in that community. I then adapted those lessons to better fit what they were working on, their reality. After making those adjustments, the class became much more engaged, responsive. Participants started sharing how they could apply those lessons directly to their businesses. Receiving the unexpected feedback from my supervisor, was uncomfortable at first, but it turned out to be incredibly helpful. It taught me the importance of listening without taking it personally, and being willing to adjust my approach, which is a skill that's vital in nursing, where patients' backgrounds, their needs, and communication styles are different. In answering a question about a time when I demonstrated the qualities of empathy and strong communication skills it was during my clinicals. I cared for a resident who had a lot of difficulty speaking and eating, and whose family, rarely came to visit. Communication was a real challenge, and it was hard to understand what they needed. At the beginning, they seemed withdrawn and frustrated because I was new and I didn't know much how to care for them. I could tell it was hard for my resident, and I could understand it takes a lot of trust to let someone take care of you. But then I realized that if I wanted to care for them effectively, I had to find a way to connect. I started paying close attention to their gestures, facial expressions. I learned how to how they use small movements and writing to communicate. I made sure to be patient and give them time to express themselves during or instead of rushing them. During meals, I was encouraging. I spent a few extra minutes just sitting and communicating with them, even if it was mostly through like smiles and small gestures. But over time, I started to notice a big change. The residents smiled more often, seemed calmer, and began to engage more during our interactions. That experience, really showed me how much the simple act of, empathy and establishing like a genuine connection can mean to someone. Even when words aren't there, it showed me that good nursing isn't just about performing tasks. It's truly about connecting with your patient, understanding their needs, making them feel, seen and cared for. Answering the next question on why should you admit me over, other applicants for your nursing program, is that, nursing programs, they're very competitive. I know it takes more than academics to stand out among, other candidates. What makes me unique are the experiences and personal qualities I bring, like empathy, patience, adaptability, the ability to connect with people from like diverse backgrounds. So my 3.5-month seed internship in the Philippines gave me experience teaching and mentoring over, it was like 90 small business owners and, schools, churches, community centers. I had to communicate clearly, adapt to cultural differences, and build trust with people, I've never met before. But beyond that, my personal caregiving experience shaped me even more. So I cared for my 88-year-old grandmother while in my first couple of years in college, helping with tasks, medications, and just emotional support, especially when my grandpa just died a few years earlier. Also, getting married at the young age of 22 has really matured me, and also taught me patience, attentiveness, and how to support someone consistently. These unique experiences taught me how to, listen, understand, and respond with compassion, which are skills that are really essential in nursing. I believe this combination of real world experiences and personal caregiving makes me a unique candidate. I learned to adapt to challenges, communicate really effectively, and just help others. These qualities will allow me to contribute meaningfully to your program and help me overcome the many challenging aspects of nursing school. That maybe other candidates might have more difficulty with. I just want to thank you for your time and consideration for watching this. It'd be a privilege to be a nursing student at the Fay W. Whitney School of Nursing. Thank you.